Welcome back to another episode of the Heart of Local, where we highlight awesome providers doing great things in their community. And today's show, we have Miguel Gonzalez from WFMC with us. Miguel, thank you for joining us.
Tim, thank you for having me. I really appreciate it.
Yeah, so I'm excited to learn more about you and your role at WFMC Health. So why don't you just kind of give us a little background? What is your role there at WFMC Health?
Yeah, so I'm a behavioral health provider here, licensed professional counselor. So yeah, I pretty much see patients here at the primary care clinic, and I support primary care physicians when anything behavioral health wise and mental health wise comes up here in our clinic.
Yeah, so what does a typical day look like there for you?
Yeah, it kind of fluctuates actually. Being at a primary care clinic, it's some days I'm available for the primary care physician at any time. So we have patients coming in here for medical visits. So anytime the primary care physician needs us, we are available. At least I am as well. So our schedule is set up in that way. I also have days where I have follow-up appointments that are scheduled as well. So I am able to have a little bit continuity of care with our patients here that need to be seen X amount of times.
That's great. So I'm
Yeah.
curious, like what led you into this field? What made you wanted to be a licensed professional counselor?
Yeah, that's a great question, Tim. It kind of just fell in my lap, actually. I knew I've always wanted to work with people in this sort of setting. I think when you're in graduate school, you really don't know what that looks like at the graduate level or like credentials. But I know that I have a background in psychology and sociology. That was my bachelor's, and then yeah, what kind of led me into that is when I was in my undergrad, I got to learn a little bit about what's the next step, right? Those opportunities after graduation in college. So, yeah, I found a program. I actually went to Western Oregon University, where I did my undergrad and my graduate program. So that's where I learned more about my credentialing, and that's where I got my higher education completed. So I knew I've always wanted to work with people in a clinical setting, so I was really fortunate to have people kind of guide me how to get to those steps.
That's awesome.
Yeah.
Yeah. So on that note, was there anybody in particular that inspired you, or kind of a moment where you had like this aha moment that yes, this is what I want to do?
Yeah, it was actually one of my undergrad professors. I had the opportunity to do a little bit of practicum hours with students at a middle school. So you kind of got like that little bit of a, kind of client counselor type feel of working with somebody. So that I think that practicum experience really opened up my eyes at what it could actually look like in a counseling setting. So I really am fortunate with like being exposed to that in my undergraduate program. And that's kind of what kind of led me to the conversations about, yeah, where what are the next steps to get into that role, right? Of becoming a licensed professional counselor. So
Nice. What
yeah.
kind of schooling, like all in, did you have to go through?
Yeah, so I went through, got my graduate program, my bachelor's of science in psychology, and then I went to a master's program, which is rehabilitation counseling, but now it's called rehabilitation and mental health counseling. So they kind of have changed their names. So so I ended up obtaining my master's degree, and yeah, and then from there on, I was able to get credentialed with the board to do what I do.
That's awesome.
Yeah.
So how does behavioral health, you've already talked a little bit about it, but how does it fit into kind of the overall patient experience at WFMC Health?
Yeah, Tim, that's a really good question. One of the neat things about here is, again, we're a primary care clinic, right? So a lot of patient comes here for that. With what behavioral health kind of fits into this clinic is the really cool opportunity for patients getting to have their first experience with behavioral health. Having that accessibility part is really cool, I think, for patients. So, and as I mentioned a little bit before, anytime something comes up in regards to behavioral, mental health wise during the medical visit, they have that accessibility immediately versus having to, possibly be referred out somewhere else, the physician's able to go get one of us to come and talk to the patient right there. So,
Right.
so very vital, right? Particularly if the patient has never accessed behavioral health before. So, and we tend to experience that a lot here as well. So, kind of like we're like the first ones to make contact with them and inform them about these services.
Right.
Yeah.
So, I mean, I'm guessing I mean, because it's very integrative and the integrative healthcare approach at WFMC, um, I mean, that gives you a unique environment in many ways. Do you want to expand on that at all, or just like how that really helps with the patient?
Yeah, I think there's also like a lot of medical stuff that comes up with like physiological stuff that could be medical as well too. And also with behavioral mental health, there's also that component like anxiety, right? Rapid heartbeat, sweatiness, headaches, right? So it's a very cool, neat experience of being able to work with the medical side with them and being able to like, hey, maybe it's a little bit of both. Maybe there is something medical going on, but maybe it's just anxiety, right? So that's where we're able to step in and support the patient with that type of care.
Nice.
Yeah.
When a patient first comes to you in the behavioral health side of things, how do you want them to feel when they're meeting with you?
So I want them to feel welcome. I want them to feel heard. I think those are like the two big things for me is being able to feel welcome and heard, particularly if they have never met with a behavioral health provider before. So I would say those would be my two top things.
Right. So, welcomed and heard. I mean, it seems like that would go a long way to building trust.
Yeah.
And it seems like that'd be really important. Do you want to
Yes.
talk any more about that, or does that boil it down pretty well?
No, yeah, and I think also just being able to I think also how you build trust as well too is also how you come into the room as well too, particularly when we are asked to come in during the medical appointment, or maybe the medical appointment has been completed, or maybe I'm talking to them before they talk to their medical provider. Is having a good tone of language, good body language as well too. I think just the way you present yourself, authentic self, can go a long way in just being able to create some trust and maybe some rapport with the client as well too. And I think also just informing who you are and what you're there for as well too. And it's also again, we all also inform that this is totally voluntary as well too. We just try to cover that whole scope of the whole of the patient, not just the medical part as well too. But if there is something going on, of just kind of informing what we do. Um, and have a conversation about that.
Do you speak multiple languages?
I speak Spanish and English. Yeah, I
Okay.
speak both. Yeah.
I asked that because WFMC Health is really it's really important. Kind of the culturally diverse,
Hmm.
language diverse patients that you guys serve, and
Yeah.
so it seems like that'd be a really important part of how you approach patients, make them feel comfortable, make them feel welcome,
Yeah.
to build that trust.
Yeah. Well, you bring up another great point too, and I do work with a lot of Spanish-speaking patients, and first most, I like working with a lot of different diversity. I mean, I like working with different ethnicities, different backgrounds, different ages. But when it comes to working with when I get to speak Spanish with a patient, one of the things that in order to create trust, having a provider step into the room, if that is their predominant language, I think I see a big change in a lot of the patients of like their demeanor, kind of I even for myself when I go to the doctor, I get a little anxious too, right?
100%.
So I think that's just a natural feeling, right? A patient is going to feel that way. So when I step into the room, I think maybe if they were to hear me speak Spanish in their language, I think what I've observed is there's a little bit of a ease that kind of comes down a little bit, and I think that maybe allows the client at times to feel a little bit, a little bit more welcome, maybe a little bit more, kind of create that trust and that rapport that you and I are talking about.
That's great.
Yeah.
So, without sharing personal details, of course, but
Yeah.
what does progress look like, as somebody starts working
Yeah.
through this process with you?
Yeah, that's a big question, because every situation is, patients access us for many different things, right? I think it's really cool when there needs to be participation, right, of the patient as well too in this setting. But I think progress can be defined in many different ways. I think patients will view that differently as well to what is progress to them. Um, but for me, it's also great when the patient keeps coming back. Even if the clinician, if I feel like, wow, like maybe we're not getting any much progress, but they keep coming back, so they might be benefiting from something. So that's good. But also when they start applying things that they have been wanting, everybody comes with different goals or things that they want to work on. So when you see clients working and implementing some of those skills that we've been discussing in our clinical setting, and when it's working for them as well too, I think that is awesome as well too. Or when they are recognizing that they're already doing things on their own, that it's being very helpful, right? Or I didn't know that I was doing that, and it's actually been helping me. Now I'm aware of that, right? So kind of having like those moments, right, for themselves. So which is really which is a privilege to see, on this end as a clinician.
That's great.
Yeah,
So what, you certainly probably deal with, difficult days. What keeps you going through difficult days?
yeah. Well, making sure that I have a life outside of here. I kind of revert. I do things. I have my personal life. I like to exercise. I love sports. Making sure that I'm spending time with my family, but also I'm very privileged to be working with a good amount of a set of clinicians. Our behavioral health team, I feel like we consult a lot, so I think that keeps us grounded to make sure that we're providing the best care for our patients, but also being able to not just the behavioral health team, but we have different departments here. When we talk about integrative care is not just behavioral health, medical, but we also have medical assistants, we have nurses. So we are also consulting with them. So just the ability to go and talk to a colleague about a patient, that to make sure that we're providing the best services and having that support is really nice. I think that kind of keeps me grounded. That I have those channels of support as well too, and I feel like our administration too is very supportive as well too with the things that we need as well.
So that leads me kind of to the question of like what led you to WFMC Health in the first place. Sounds like you've got a great team. What led you there?
Yeah, so I come from a background, actually, I came from like long-term therapy, kind of an agency that focuses on that. Here at a primary care clinic, the behavioral health program is that integrative piece, a little bit more different flow. But actually, I used to live like 3 blocks away from here. I've pretty much pride myself of being here because this is my community. This is the community I grew up in. So it's been really a privilege being able to come back to where I went to high school, where I went to middle school, and being able to provide the services that that I'm able to provide. I think to me that's just a really special thing, and it's kind of been kind of a full circle for me.
That's awesome. Love that you're
Yeah,
serving your community. Just
yeah,
kind of in closing, like if
yeah.
maybe just to address one more time, like if somebody is unsure about, seeking help or utilizing the services there that you can provide, what would you say to them just to kind of put them at ease?
Yeah, ask questions. If you trust somebody that maybe has access to services, to be just come familiar with it as well too. I'm reverting to where I am at a primary care clinic. If you have a doctor, ask them questions they may not know. Yeah, just become familiar with the process and what this setting looks like. A lot of the time, I find myself with our patients informing what counseling or what therapy is. And also, I think there's a lot of stigma within within many different cultures still. Um, and also accessing these services maybe may be viewed negatively sometimes. So just really understanding of what it is and how we can all benefit from this. When needed. I think it's just asking questions and becoming familiar with the process. And I think also just as us as clinicians, what we try to do here is inform as the best we can what this experience can be. So yeah, just ask questions, become familiar with it.
That's awesome. Well,
Yeah,
thank you, Miguel, for spending some time with us, and thank you for the care that you provide for your community and there at WFMC Health. And we look forward to sharing your story.
cool. Awesome. Thank you very much, Tim. It's been a pleasure.